This is Weekend Connection. Weekend Connection is a public affairs program from the Bible Broadcasting Network. It's heard every Saturday at this time. As you listen to Weekend Connection, you'll hear interviews with people of interest to you, with information that is important to you. And now, let's get connected.
And today on Weekend Connection, we're speaking with Dr. Alicia Budd, representing the Centers for Disease Control and Prevention, the CDC. And Dr. Budd is going to talk about the flu. How are you?
I'm doing great, and thanks for inviting me to talk to your listeners about flu.
Certainly. Suppose I'm feeling very bad and I go to the doctor and the doctor says, yep, you have the flu. My first question for you, Dr. Budd, is what is the flu?
So the flu is a respiratory illness that's caused by a virus called the influenza virus. The most common symptoms with influenza are sore throat, cough, fever, body aches. Some people also have a runny nose. Some people, more likely children than others, may have some GI illness, some diarrhea or stomach discomfort as well. But primarily it is a respiratory illness.
I suppose sometimes we tend to confuse the flu with cold symptoms. How severe can flu symptoms be as opposed to, say, the symptoms of a common cold?
Flu can cause a whole range of severity, but it can cause quite severe symptoms in some folks, leading to hospitalization, sometimes even an ICU stay, and in certain situations, unfortunately, influenza can cause mortality in folks. And so it really is wide-ranging. There's a number of differences between flu and the common cold, the organism that causes it, for one thing, but also the rapidity with which symptoms come on. That's sort of a hallmark for flu infection. Many folks will tell you, I felt fine in the morning, and by lunchtime, I was down and out in bed. And that's more of a hallmark of flu than some other respiratory infections.
Again, we're speaking with Dr. Alicia Budd from the CDC, and we're learning about the flu today on Weekend Connection. I think maybe we can expect, say, the common cold to last about a week. How long does it take for us to recover from an outbreak of the flu?
Again, there's a wide range there. It can be, 4 days to a week for the primary symptoms, but a lot of folks will have a lingering cough for some time period afterwards. So it's not a hard and fast rule on how long your illness can last, but you're usually feeling really miserable for 2 to 4 days if you're an otherwise healthy person. Now, if you're a person who is already dealing with some underlying conditions, diabetes, lung conditions, heart conditions, things like that, you could have really severe symptoms that last for even longer.
Now, I assume that when we have the flu, at least for a period of time, we are contagious. Is that correct? And if so, how long are we contagious?
That is correct. We tend to think that we're most contagious with flu during the time that we have a fever. So it also, your period of being contagious, or when you can spread the virus to another person, can actually start a little bit before you even may realize you have symptoms. And that's one of the hard parts about stopping transmission, is you may be shedding the virus to other people before you even realize you're sick. But then once you're sick, typically, again, about 4 days or so, 2 to 4 days with fever, and that's when you're most contagious. That's when we suggest that you try to isolate yourself away from other people as much as you possibly can. Make sure you're doing a lot of hand washing. If you are coughing or if you are sneezing, make sure that you're doing so into your sleeve rather than into your hands. That prevents the virus from going out into the air. It also, if it's not on your hands, you're less likely to contaminate other surfaces that people might come in contact with.
And looking at it from the perspective of one who does not yet have the flu, what sort of measures should I take to help ensure that I don't catch the flu?
The number one thing that you can do to minimize your risk of getting influenza infection is to get the influenza vaccine. And this is a vaccine that gets reformulated each year based on the best available data about what we think the most common flu strains are going to circulate for us in the Northern Hemisphere each winter. And so that decision is made by an international body, by the World Health Organization, and they look at data worldwide because the flu viruses are not, of course, confined by any borders. They can spread with travel, with any movement of people. And so this organization of scientists who work on influenza worldwide come together twice a year to make a decision about what strains need to go into each season's influenza vaccine. And we know every winter in the United States, we're going to have circulation of influenza viruses. We often have circulation of two different influenza A viruses, what we call an H1 and an H3, and two different influenza B viruses, what we call the Victoria lineage and the Yamagata lineage. And so the vaccine each year will contain at least three, and most vaccines contain protection against 4 influenza strains, the ones most likely to circulate each year. So you want to make sure you get the vaccine, and you want to make sure you get a new vaccine each year so you're protected against the most likely strains for that coming season.
And again, we're talking with Dr. Alicia Budd from the CDC about influenza, how we can avoid getting it, and what we should do if we do get it to help stop spreading it and maybe recover a bit more quickly. Dr. Budd, have there ever been any strains of the flu for which we were not able to develop a vaccine?
Sure. Sometimes it's more of an issue of timing because flu viruses are constantly changing. They go through a process that we call antigenic drift. It's how they try to avoid our immune system and, in this case, also, and a lot of times, our vaccines. And so the decision about what strains to go into our vaccine that starts getting put into people's arms in the fall, that decision actually gets made in February. So there's about a 6-month window between the time the decision is made and the time that the vaccine gets administered to people because the vaccine manufacturers need that time to actually produce the vaccine. And so what happens sometimes is that a new strain or a different strain will arise between the time the decision is made and in the time that the vaccine is given to people. And so that's what happens sometimes when you hear about a situation called vaccine mismatch. It's not that a vaccine can't be made against that new strain, but it's that new strain wasn't out there in time for the vaccine to be made in order for us to receive it.
When I receive a flu vaccination, do I have to take a shot or can I just take a pill?
There is no pill, but in addition to the shot, the shot is the most common, but there is also another way you can get the vaccine. It's intranasally, so it's a mist that gets sprayed into your nose. There's a slightly narrower group of people for whom that vaccine is indicated in terms of age range, and some people with certain underlying conditions are not recommended to get that nasal spray vaccine. But it is definitely an option for some folks, and I encourage people, if you are needle averse, not to automatically write off the flu vaccine because there are so many advantages to getting the vaccine, and there is this other option. So definitely encourage folks to talk to their healthcare providers about what might be the best option for them.
What demographics are most susceptible to catching the flu?
Even healthy people are certainly susceptible to catching the flu. We often see it transmit most frequently among children just because they're not always the best at controlling their respiratory secretions. And that's how we see flu transmit the easiest. So it often goes through school settings quite rapidly for that reason. But really, any of us, even healthy people, can get the flu. Now, there are certain groups of people, once they have been infected with flu, who are more likely to have the more severe complications. And those are the very young children, the elderly, and those of any age who have underlying conditions, in particular things like diabetes, asthma, other lung conditions, heart conditions. Pregnant women are all those groups, and some others are really most likely to have a higher chance of a severe infection, not just feeling really lousy in bed for a couple of days, but possibly needing hospitalization and intensive care.
Dr. Alicia Budd from the CDC informing us about the flu. Dr. Budd, should I get the flu vaccine at my doctor's office or a pharmacy, or does it matter?
Both of those are very good options. it's much more common these days than when I started working in flu to get vaccinated at a pharmacy. Pharmacists are well educated on risks that you need to be aware of, anything that you might need some education on, and so that is a very viable option. It's really what's most convenient for you, what you're able to get done, because what's really most important is that you're able to get the vaccine. And the ease with which you can get a vaccine at the pharmacy really does take away some of those barriers that folks used to encounter when it was trying to schedule an appointment with your doctor and things like that.
Are there any risks associated with getting the flu vaccine?
The flu vaccine is a very safe vaccine because it gets administered annually. We have years and years of data and safety data as well as effectiveness data on the vaccine, and it is very well studied, very safe, and I highly encourage folks to get the vaccine.
How early in the year did you say, or have you said, we may actually get the flu vaccine for it to be effective?
So you can usually start being available towards late summer, early fall. August and September is when you start to see doses available at your doctor's office and your pharmacy. We don't really have an ideal, too early time period, but what we do encourage folks to do, really what you're trying to do is make sure that you get vaccinated before flu starts circulating in your community. The tricky part with that, though, is that every year that timing could be slightly different. So we're really trying to thread the needle of waiting as long as possible, but yet making sure you get vaccinated before flu is in your community. So what we say there is try to get vaccinated by the end of October if you can. I don't want people to think that, okay, I missed the October window, there's no point now. That's absolutely not the case. I would strongly encourage anyone who hasn't been vaccinated yet to not think it is too late. I would go out there and get vaccinated now. We are seeing flu activity increase, so it's the perfect time to make sure that you can get protected. It does take about 2 weeks after you receive the vaccine for your body to mount the immune response, the protection that you need. So you want to try to factor that in too. So I would definitely say go get it now if you haven't yet.
And despite my best efforts, suppose I get the flu. You mentioned it's going to take some time to get over it. Should I just stay in bed, drink a lot of water, as we've always heard?
That is good advice. You're going to want to rest. Certainly, you want to try to keep yourself away from other folks so that you don't share your infection with them. But there is also some medication that can help shorten duration of symptoms as well as decrease your chance of getting a severe complication if you are one of those folks that I talked about before who's more prone, based on your underlying conditions, to have a serious infection. And so what I would encourage folks to do, call your doctor. They may want you to come and see you. They may be able to do sort of telemedicine over the phone. It depends on the situation, but I would definitely encourage folks to call their physician. And if your physician recommends and prescribes what we call antiviral medication, that's the medication that will help shorten symptoms and potentially decrease your risk of severe complications. So you have that alternative available to you as well.
And I know the CDC also has a website. I assume that's a resource for finding out more about the flu and other illnesses, correct?
Absolutely. The general CDC website is cdc.gov. If you want to look particularly at influenza information, it's just /flu, F-L-U. There you can get information. We put out a report each week about what strains are circulating, is activity going up, going down, how does it look this year, as well as a lot of information about the vaccine, the antiviral medicines that I mentioned, and many other interesting and important facts about flu that your listeners may find helpful.
Well, today we've been talking with Dr. Alicia Budd from the CDC, the Centers for Disease Control and Prevention, about the flu. Dr. Budd, thank you for joining us today. We've appreciated it.
Thank you for having me.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.